everybody. As we age, here's something else to think about. We lose volume in the back of our hands, causing the appearance of tendons, wrinkles, and veins to become more pronounced. Dr. Ellen Marmer, one of the clinical study investigators for a Restylane lift for hands, is joining us today to talk about a possible solution. All right, doctor, why do wrinkles, tendons, and veins look more pronounced as we age?
Yeah, so my patients, men and women, both are disturbed by the fact that they can't lie about their age anymore when they show their hands. So we can take care of our face great, but now we can take care of our hands just as wonderfully. Hands will age genetically, and we can't really change that too much, but also from sun damage, from athletics and sports and accidents and driving, all kinds of stuff take a toll on our hands, so they can be kind of veterans. But the great news is you can use your sunscreen starting now, every day, and use your moisturizers. And just like Restylane Lift was already FDA approved in 2 other areas, the nasolabial folds and the cheeks, now it's the 3rd area on the back of the hands. And it is the first reversible hyaluronic acid filler to be FDA approved for the back of the hands. In the studies, we injected just about 4 or 5 little small points between those tendons on the hand, so in the valleys between the knuckles and the wrists, 1, 2, 3, 4, 5, and just massage the filler, which is looking like it looks like a transparent gel when you inject it under the skin. When we massage it, it kind of spreads over all those tendons and bulging veins, and then leaves you looking like a normal, younger-looking self. So the filler we usually see back after 2 weeks just to make sure everything looks good. Maybe you need a little bit more. And then it lasts in the studies out to 6 months.
Okay, so then that's your upkeep. Every 6 months you go in and kind of get a little bit more?
Yep, and then to prepare for when you come in, you want to make sure you take care of your hands so that you don't have any rashes or anything. Your skin is looking good. Come on in, tell us any medicines you're on or any issues that you've ever had, and then when we inject, the side effects are always minimal. So in the studies, it showed that the side effects were temporary and mild, possible little pain where we inject just a little bit, not bad at all, and then a little bit of swelling is normal, and a possible little bruise that resolves itself over about a week or 2.
I mean, this is going to be such exciting news for so many people out there for sure. You mentioned the sunscreen, putting it on your hands, and just a hyaluronic acid is so important, right, to kind of make sure that you can delay sort of the onset of these wrinkles, right?
Yeah, so the hyaluronic acid is in topical products, and it pulls water to it, so it makes a really good moisturizer, sort of locks in the moisture. And ironically, hyaluronic acid is the key ingredient in the filler itself. So really, it's bringing your own body's natural water to the hand. So by using your creams that have it in it and using your filler that has it in it too, you're really kind of keeping with nature and using the water to cause the volume restoration in your hands.
I think this is so exciting. Okay, where can we learn more information?
You can learn more at RestylaneUSA.com, and a recent study showed that 2 out of 3 women were very interested in rejuvenating their hands. So at RestylaneUSA.com, you can learn more about this non-invasive treatment.
I love it. Doctor, thank you for talking with us today. This is very, very cool stuff.
Yeah, have a great summer.